So my name is Claudia Sawyer. I am the finance person for the Mental Health Coalition, and our main focus or purpose for this video is to give a brief intro with regards to the UniMaK COVID-19. UniMaK COVID-19 is being implemented by the University of Makeni, and the co-implementer is the Mental Health Coalition funded by the CBM, that's the Christian Blind Mission. We are the funder of the COVID-19. The areas that they focus on are key implementing in districts that they consider the western area, urban, rural, Kenema and Kabbalah. CBM had been operating or have been operating in these areas for quite some time, and I think that's the reason why they focus on these key areas. And basically the beneficiaries for this COVID-19 are the persons with disability. They are the key beneficiaries of the COVID project. And the COVID project is basically to support them within this challenging period, to provide funds for them to be able to purchase or get the basic household sanitary items to protect them against the COVID, and they considered masks, laundry soap, and also hand sanitizer. These are the key items that was being considered during the COVID to support the people living with disability. And also it's also to be able to include the persons with lived experience, so like working with SLUDI, so that they will be able to include persons with lived experience. So SLUDI are also one of the partners to the project. And we also provide for them funds that they will be able to use to support their household, and funds also to support their businesses. These are the things that we are providing during this COVID period. As items we are distributed to the 4 districts named earlier, that's Western Area, Urban, Rural, and Kenema and Koinadugu. We first of all prepare a questionnaire in which we obtain valuable information from the beneficiaries, and eventually compile those lists based on their response in order to identify the key beneficiaries of the items. Then after identifying the key beneficiaries, we went on to prepare a list in order to do the distribution. So we went to the various districts with the items, the sanitary items, and distributed to beneficiaries in all of these districts. And also, we also use the SIM couple as agreed to be able to transfer the funds to the different beneficiaries. We are faced with some challenges with regards to the SIM couple because they sent it via a text message to the individual numbers. Some people's phones were off and they were unable to receive the money, and some were not even versatile or having the knowledge with regards SIM couple. They assume it's one of the mobile money, and mobile money normally transfer money directly into your phone, while the SIM couple you will need to go to the agent in order to retrieve your money. So instead of them going to the agent at the bank or the agent to retrieve their money, they just deleted the message, assuming the money will get into their phone automatically. So we have so many of them, we are unable to access the funds. We did follow up, and we had to spend more in communication in order to get them on board, in order to be able for them to retrieve the money.
My name is Leone. I'm the field coordinator for the Skyline to Stigma project and also the field officer for the Mental Health Coalition SIU. I was part of a team that was involved in the training of persons with disability of business management, and sustainable growth. And as you can see, this was the manual that was used, all thanks to the UniMaK team that were assigned with the training. I was just part of the team to coordinate and also do the planning towards the program. So a few of the issues that we have treated, we are one, the challenges of setting up a business, the role of the business, adding value, and I think this project was a timely one. As we all know, the pandemic actually affected a lot of people. So I want to say big thanks to CBM for the fund, and the people really appreciate the project officer and specifically this activity where they were trained on how to handle business.
Well, that business money when I give you, I may own this because me not disabled. I know you work. I've been the beg, but for when I give me that money, I stop for beg now. Bye bye. I begin sell. I begin to run on the veranda now for the sell. Well, I will support me picking them. So I get 3 picking. My mom now, they don't do enough. So that they don't help me great. Well, I will support me picking them. I don't feel happy, but right now I need the beg again. So I tell them plenty thank you. We need more support for let the business increase more. I tell them plenty thank you.
First of all, I want to tell you plenty thank you. But for my I can sort for you. For me, that money they benefit me because my business they don't collapse. But because when you do business, you forget starting. But at that moment they are not get starting. But I tell you now, that money that's then give me God make sure that God can put blessing in the business now, no problem, don't go. Through on behalf of Dande, now you will buy this. And through on behalf of Dande, you don't give me more lane back, as I tell you so. That money they benefit you say and you open lane for me back. Now we no more you worry, if I don't go take what that document will go so you say my proof and to Bembe for me for the sake of that money there. He helped me Bembe because person been there where they think about in terms of helping me. But through on behalf of that money, as I get that money there, now I go buy material, I can't begin make. Because I begin make the profit now buy this phone with, as I tell you so.
So I mean, they use that money there while they sell and they get 10,000 for anyone back that phone. Yes. Now I be they take, I they pay transport. Now they take, I they pay me practicals there. The profit I know me know what's in our account. Now behind this money maker, I will know what's in our account. I go Roque Commercial Bank, I go OP account. Now they say, you they work with the car OP account. Now I say, no. I say, boy, they do business. Which business way they do? I say, they sell coal. Charcoal now they sell, like they can't do OP account. I say, yes. So what I say, any month, the small what they get, and they go left and day. So I tell God thank you for now. So I tell una boku thank you. Una don't really do something in my life.
The total beneficiaries really now 260. We come off from OTC. We now one of the OTC. This our deaf, albinism, epilepsy group, SLAB, VTCB, little people and people with hornback. So now then categories then really we then target this morning for these items. So about 263 beneficiaries from 10 existing DPOs then are Kenema. So I really appreciate them all, and I hope say this not going to be one-off. Then we'll continue for camp as still COVID day. I go wish for a continuity of such a gesture. Thank you so much. So
I'm Moses Joseph Sam, the Networking Policy and Advocacy Officer of the Mental Health Coalition Sierra Leone. Yes, this COVID-19 emergency response project was done with the views of people living with all categories of disability. When we are doing the awareness raising activities, we actually looked at what the situational analysis, the data collection brought out. We looked at the gaps that it highlighted, and we developed the flyers, we looked at the jingles, and we did the video montages. So in every aspect of these that I've just mentioned, we did it with people living with disability, not for people living with disability. I think this is what CBM is trying to promote, that we should support inclusion, especially in crisis situations and in every other aspect of our planning as a society. So we say bravo to CBM for giving us this opportunity, for giving us the funds. We also say thank you to Slowly for working with us. We say thanks and bravo to the Mental Health Coalition and to UniMaK for jointly implementing this project. Thank you.
I am Edward Mundaja, the Programs Manager for Mental Health Coalition Sierra Leone. We are thankful to CBM for funding the UniMaK COVID-19 project, which we implemented during the course of this COVID. It was a good intervention, and we were able to look at the fear. People were afraid because of the impact of Ebola, and so people were not even on their guards, and the psychosocial effect was too much. So what we did in the development of the posters we had to print was to look at resilience building, how people can get hold of themselves and then prevent themselves and then support others in COVID-19. So we printed 500 copies and we distributed it. People were really grateful, especially our partners like Slody and the coalition chapters in those districts for receiving such posters, which they claim it helped them to raise awareness on prevention of COVID-19. Thanks to CBM and our partner UniMaK. So you can see the work we did. This is just a sample that's left in the office, and you can also see. You can see. Thank you.
Coalition and team player with UniMaK as well as Slody, we have learned that carrying out activity is not all that requires in project implementation. One of the great things we look at is the impact at the end of the day. And this project resonated with three key impacts. Firstly, around the data. It informs that quality project implementation requires a clear information as to who your target is. And this data has been helpful not only to respond to the COVID crisis situation, but also to reference in terms of planning, in terms of development, with regards persons with disability of all categories, and in 4 key districts. This has been very, very instrumental, and it informs quality data. The second phase is around information. As Sierra Leoneans, and especially in crisis situation, you would agree with me that a whole impact could be right or wrong based on the information you have. There has been this gap with regards inclusive mainstreaming messages that was not so evident in government response to the crisis situation. So the project was able to identify the gray areas, and those gray areas really complemented the work that UniMaK, Mental Health Coalition and SLUDI undertook. And we are able to bring out key messages via jingles as well as posters in the community. And we realize that people with disability, especially those with hearing impairment, we are able to take conscious effort based on the fact that the message was tailored to meet with their needs. And so what we record as spread, what we record as increase in the number of persons with disability was halted just because of the right information. And the last aspect, which honestly seemed like mind-breaking, is the unconditional cash transfer, the hygiene kits, and the support to small-scale business that we are being dropped down because of the crisis situation. The assertion that people with disability have had to deal with was proven wrong during this intervention, as every one of them complied. When I say complied, accordingly, including their household, with regards preventing the spread of COVID, which was the ultimate goal in the intervention. You would agree with me that we had already gotten a huge number, a huge chunk of flow of those who were affected, but the precaution was actualized with the right message and the required necessary hygiene support to stop the spread. And also we realized that the unconditional cash transfer netted a lot of survival needs at the end of the day. People were able to have access to food. The going out to the street for alms was reduced drastically, and based on our statistics, by 48.67%, just because of the intervention. And of course, the small-scale business caused individuals, as you would reference from the clips, caused them to be able to have a huge transformation around their basic survival and basic vocational and basic business skills. And you know what CBN has been doing is not to only give you the resource to work on, but to also give you the required skill. If I am to implement with all of these lessons learned, I would assure you that we would consider it very big. However, transferring funds over the years in all programs has been a challenge. There were some challenges around the cash transfer, which took extra effort and energy. And this one singular area is something we'll continue to learn and work on for a viable program and project development. Thanks to CBN, thanks to UniMaK, bravo to the Mental Health Coalition, and superb to Smoothie.